Hello, and welcome everyone, our loyal viewers to
Our
this
loyal
week's- maybe our loyal viewer, maybe. Okay, hello everyone, anyway, and welcome to Webinar Wednesday, the last Webinar Wednesday of November. So
I know, blooming hell! It's nearly Christmas, and for what it's going to be this year.
yeah. Well, that's the talk on the streets, isn't it? At the moment, what is it going to be this year? Christmas?
What's it going to be?
Yeah.
Yes. So you've seen the new rules that we're going to have this temporary 3 household thing over Christmas.
Yeah, I'm still trying to process that a little bit and work out what it actually means, really, and what it could mean. Obviously, everybody will be doing that. What it could mean for us as a family.
Yes.
I'm not wanting really to, I suppose, on a personal level, just want to be relatively cautious about that sort of thing and thinking what it. Yeah.
Yeah. No, exactly. I mean, we're having debates about whether, so like Wendy's folks are in Fife.
Yeah.
And whether or not we would stick with a day trip.
Yeah.
Which we can't do at the moment, but even a day trip, or whether an overnighter would be a reasonable thing to do. You know what I mean? And
yeah.
We still haven't decided because that, like you say, you don't want to. It would be very easy for this to turn into another big increase. So I think it's going to be difficult, isn't it?
It is, and it obviously, just as we've been the last how many 8 months now. You have to take things day by day, don't you? And things changing all the time. So and the clarification around things changing all the time. So yeah, definitely. Bubbles is a strange thing to think about, isn't it?
Bubbles. I know we've been thinking about the bubbles, haven't we? So we've got to.
Yeah, it is a strange thing to think about. Anyway, we are back in our normal routine on Webinar Wednesday, and we have 2 lovely guests later, don't we, Alistair? So at 10:15, we will be joined by Chris and Gosia from Health Improvement Scotland.
Yeah, that's right. So they're going to tell us a little bit about their role as engagement officers and a bit more about what they do, and hopefully that'll be a good. I've known Chris for quite a while through the Learning Disability Group of Aberdeen, but obviously there's been a change of roles, so it'd be good to hear a little bit more about that.
Yeah, good. Interesting. Okay. Yep.
So we had
yesterday we had our AGM, our annual general meeting. Scotland's annual general meeting. So that was the 11th.
11th AGM.
Yeah, 11th AGM. Yeah. Last year was the 10th. So that would work. So it was the 11th. It was the first. Obviously, it was different because it was online, and it was relatively succinct, wasn't it? We didn't stick around too long.
No, we didn't.
And I think we probably could have kept on talking, couldn't we? Well, maybe that's just how life is, but we could have kept on talking at the end of it.
No, we're just kind of doing a bit of reflection on that, and yes, it's good to not run on too long, but I think there is that thing about how do we make sure that we keep the conversation flowing, and I think people get excited and engaged when we start talking about some of the stuff that matters, how we link up some of the different strategies. And I felt like we were really getting going yesterday. So and I suppose that's the challenge. A lot of this stuff is keeping a lot of those things connected, keeping it happening over the piece. We've got DJ Fireball joining us because that's another thing that we're connected to is the stay up late stuff. You've got another one of them coming up.
We have, on the 4th of December, we've got the next Stay Up Late music sessions. But this time we're also going to have a social beforehand. So we've got social between 8 and 9, which is open to anyone who wants to come along. And we don't know what social means yet, really, do we? We just mean get together and talk, have fun, maybe a couple of things that'll interest people. And then at 9 o'clock, we're going to do our regular first Friday of the month music sessions. Bringing you new and inclusive music. Me and Michael bringing you new and inclusive music from around the world. That's how I like to describe it, anyway. So
you just need a jingle for that now. Bringing you new and inclusive music. So that's cool. And then we're going to have a bit of an inclusive sort of music workshop thing, which is still a development in progress a little bit. The following Monday on the 7th, you can win No Labels, No Walls, and B-Mix.
B-Mix is an interesting music project, isn't it? That's based somewhere in South England, but they've been helping people with developing music and writing lyrics and stuff. So again, that's an open session, isn't it, Alistair?
We're gonna probably advertise it a bit more soon. But essentially, we're gonna have a little bit of a pre-session between 4 and 5 where we use some just basically some music making apps to try and develop a bit of a backing track, and B-Mix have working on turning people's lyrics into a bit of a song. So it's just a bit of a collaboration, make it up as you go along, have a bit of fun.
Anyway, so what I would say, Alistair, is don't worry.
Yes.
Don't worry.
Be happy.
Yeah, be happy. Yeah, be happy. Oh dear, sorry. Apologies.
Jokes to the usual address. If anybody would like.
Yeah.
Right. So other stuff that's going on in the world at the moment, we've got a raft of Social Work Scotland mini sort of things going on as well, haven't we?
We have, yeah. The first one's your first one is today, isn't it? The first one is the Risk Enablement one today, and then there are others that are happening over the next week. I think I'm involved in one tomorrow morning, which is about assessment and transparency and all sorts of different things. Yeah, and you're setting off on a journey, aren't you, Alistair?
I am. I'm going properly up north. I mean, some people think Aberdeen's up north, but it's not really, not compared to Shetland. So I'm sailing tonight to Lerwick, sort of to do a bit of work up there. Sort of like
it will feel almost strange, won't it? Going somewhere where things are, well, maybe it's not as strange for you, but I was going to say it'll feel strange going somewhere where things are open.
Yeah, well, I mean, we're level 2 and they're level 1, so they're as close to old school normal as anywhere in Scotland is at the moment. Yeah. So and just even the physical act of getting on a boat, rather, after all this time, because we've been so used to just our worlds have got so small physically. They've expanded online, but physically they've really gotten so small that anything new.
You feeling okay about that?
Yeah. I mean, I've been pretty careful about stuff. So I'm not going to be sleeping in a cabin. I'm going to sleep in one of these sleeping pod things, which I've been told is not a great plan in terms of level of sleep. But it's out in a big open space. So there's lots, you're not breathing in other people's air.
I think the safest place for you would be on deck. I think
on deck, lash myself to the mast.
Yeah, I think so, because obviously it's much better in open air. Yeah, and I hope you've got your torch with you as well, because this time of year there is no light on Shetland. So sorry to everyone in Shetland. Yeah, no, I actually did go on the pods once, Alistair. I used the pods once. Yeah, and I found them not too bad.
Yeah, but then you said you can sleep anywhere.
Oh yeah, I've said that. Yeah, good point. Yeah. Good point. Yeah.
Brilliant. Okay. June's keeping us to task here with giving us helpful and reliable information about what we're doing. So we've got this in the 4th, and then we've got this. So that's the stay up late one, and then we've got this other one, which will be on the No Labels, No Walls page as well. So more information will be available soon. So
and that's 4. The other one is 4 p.m. Starts at 4 p.m. on Monday the 7th, doesn't it? The one music making one. Yeah, okay. And yesterday at the AGM, you were sharing, you were showcasing and sharing a little bit of work that you've been doing with Dr. Daniel Farrell and Michael McEwen around images of disability in the media.
Yes, that's right. That should be showing just now, is it?
Yeah, it is showing just now. It
is first time. I tell you, I don't know what's happened, because some of the previous times it's taken 2 shorties to share things, so this time it is working. So this is this bit about inclusion and disability in the media. So we've just sort of said, we've got advertising that we're increasingly aware of the importance of how people who have disabilities are being discussed and represented. and as well as having a chance to shape what's being said. So we're going to do a lunchtime session, because we did lunchtime sessions with when you were organising the children's events. We did them the same sort of thing, 12 till 1:30, and they were very popular, weren't they? Because I think people could manage to squeeze that in with their working day. So we've got a couple of short films that we're sharing. Just they're not Oscar winners, but they're just a couple of just tongue-in-cheek sort of like demonstrations of some of the things that we feel we're facing. And Dr. Daniel Farrell and Michael McEwen have both star in it, and we had a bit of fun making it. But it's the other side of it is that sort of serious side of it is we're trying to look at how can we engage broadcasters, sort of self-advocates, everybody, and talk about some of the stuff like we're talking about, for example, the issue of should things be about the Down syndrome
storyline in Emmerdale,
which is very controversial.
And I was just literally in 10 seconds before we came on here, I was looking at the In Control Scotland Twitter, and somehow it led me to to a blog that the chief exec of Down Syndrome Scotland has written about that, which looked very interesting in terms of a perspective on how it's been portrayed and what's being said. So I mean, that will be easy to find if anybody wants to find that. It's a blog that the Down Syndrome Scotland chief executive wrote about the Emmerdale storyline, and and those are the sorts of things that you'll have an opportunity to discuss further as well on that session on the 15th.
Yes, I've got it here. Yeah, pass me the remote. It's called. Let me just see. I might even be able to share if it allows me. So absolutely. So it's that idea of should this be something that's only discussed in really, serious news programs, or should it be part of the fabric of, our everyday discussions? Is it helpful that?
And how I think part of that is also about how it should be discussed as well, or how it should be portrayed. So there's so that's for anyone interested, that's obviously an interesting blog that you should easy to find that in, Alistair.
It's just so it's Down Syndrome Scotland, and it's Pass Me the Remote. So I think again it's that thing about is it as he describes, is it a ratings grab, or is it a serious attempt to talk about stuff?
Okay. And then June is also reminding us there that our news brief for November is available.
It is,
and you can download it there. That big long. I'm going to try and memorize that, right? What was it?
Yeah.
Take it off. Going to try and memorize that link, right? Was it FC? No, that's not it. No. FD. Oh, FD. Right. Okay. Got the first bit. Okay. Yeah. Yes. Okay. But you can access it through the In Control Scotland website as well. That's the November news brief, and June's been producing a news brief every month with the idea that it is quite brief and it just gives you a bit of a flavour of some things. And there will be a Christmas news brief as well, which I know June is very, very keen to make engaging and to have fun things in for people at Christmas. So we look forward to that. I tried to listen to there's a programme with disabled comedians on Radio 4 last night.
Okay.
Which was it was like hosted by, it was 11 o'clock last night, hosted by the Lost Voice guy, who was people will have heard of or seen or known from mainly from the X Factor. Was it the X Factor? Britain's Got Talent, wasn't it? Yeah, Britain's Got Talent. Yeah, and it was a program about a number of different comedians, and I thought, I'm going to listen to that, right? So I put Radio 4 on, but then I never heard a thing. Because I fell asleep. So I didn't hear it. So I'll have to get it on BBC Sounds. So you can access it on BBC Sounds, obviously.
And that's a good thing. You can never truly miss most things these days, because you can always catch them as a podcast.
Yeah.
Just another thing to share before we're joined by our guests is that so this is that SCLD are developing a recovery and transformation plan around folk with learning disabilities and autism, and so they're going to have Zoom sessions on the 9th and 16th.
So just to be specific, it's the Scottish Government plan, but SCLD are facilitating the meetings.
Yes, that's right. Yeah. So it's the Scottish Government, yes. So the address is admin@scld.co.uk if you want to attend, and then they'll send you a link on there.
So it's 2 weeks from now or 3 weeks from now. So both those sessions are, So there's a chance to go to either one of those sessions. One's on the 19th, one's on the 16th. 2 or 3 weeks from now. If you have an interest in getting involved in that, so get in touch with them. You will miss part of Webinar Wednesday on those days if you do. But
that's harsh, isn't it? I mean, really.
Well, there we are. Yeah.
All right. Oh, we've got a hello from Mark as well. Hello from Mark.
Yeah.
Hi,
Okay.
Mark. Right. So, shall we join our guests?
Yeah.
So, hello. Hi to Gosia. Hi, Chris.
Hi.
Hello. Good morning, everyone.
Hello.
Good morning. So, do you guys want to introduce yourselves and tell us a little bit about what you do, and then we'll share your PowerPoint as well.
Yeah, perfect. So my name is Gosia Misiak, and I'm one of the engagement officers working for the Healthcare Improvement Scotland Community Engagement. And together with my colleague Chris, we'll give you a short presentation on how you can get involved in health and social care. So I'll tell you a bit more about our role, what we do, and if you have any questions at the end, we're happy to answer them as well. So Alistair, if you're happy to upload the presentation, we'll just start right away.
Start straight away. Okay, cool. Here we go. Okay.
Perfect. Thank you very much. So some of you might have heard of us before, but our organization was known under a different name. It was the Scottish Health Council. But after an extensive consultation with staff, stakeholders and committee members, it was agreed that from April this year, we would change our name to Community Engagement Directorate. And the purpose of that change was for our name to make our role a little bit clearer to our stakeholder, and also position us clearly as part of the wider organization, so Healthcare Improvement Scotland. So our name has changed, but our role remained the same, and we're still very much focused on helping people to use their skills and experience to improve the health and social care services, and make sure everyone's voice is heard. So the way that engagement office work hasn't changed, and there's still at least one engagement officer in each health board, as there are 14 offices across Scotland. So my colleague Chris and I are both based in Grampian. We used to work in Aberdeen office, but we're now both working from home, which has obviously both positive and negative sides, but that's the kind of situation we're in just now.
I'm just thinking that Chris is obviously, you've come along quite regularly, being engaged with the learning disability group of Aberdeen and Shire, and help people to engage with lots of different activities over the years and stuff. So it's been interesting to think about how, if there's any changes within what the new role is, or whether it just continues pretty much as it was.
Yeah, it's very. So yeah, you probably know Chris a lot more than you know me, because he's definitely been around for longer. But yeah, our role, as we listed on you can see on the slide, it hasn't changed much. It's still very much focused on helping people support them in sharing their views, shaping local services and influencing local policy. We still support health boards, health and social care partnerships to engage with their communities. Sometimes the Scottish Government asks us to gather views from the public on a specific topic, condition or issue relating to health and social care. So it could be relating to a new policy that's being developed, and the Scottish Government wants to know what people think about it and what they can bring into the policy based on their experience of the condition that they live with. So that's mainly our role.
Yeah, I was just going to say, so last week we had Malcolm Chisholm, who's part of the independent, is a member of the independent review of adult social care in Scotland. So how does what you do link in with something like that, which is that national independent review, really, of how people are experiencing social care, with the intention that it's going to provide recommendations for improvement in the future? Yeah,
Chris, do you want to jump in
answer
here?
That one. Yeah, I can maybe answer that. Can you hear me
yeah,
all right?
Yeah.
Yeah, okay, that's fine. I was having a wee bit of a problem with the microphone at the start there. That's all right though. So the gathering views work. We do projects called gathering views, and a lot of them come from the Scottish Government, and in the main part. And although we haven't done one, although we haven't been asked to do work specifically for that project, because often there are other partners involved, and they may be taking it, or the kind of working group may be taking it forward themselves. And we are off that sort of work is something that we're often asked to get involved in as part of the gathering views that we would do, and working with the Scottish Government. So we have a recent example of that, I suppose, along similar lines. Well, a couple of recent examples of that, I suppose, along similar lines, and there's reports on our websites. That would be around about, there was a maternity services review that the Scottish Government had instructed to take place across Scotland. So we were involved in speaking to maternity service liaison committees around about that. So it was all about how people are engaged in maternity services. So that's one example of work. And there was also some work done by the Scottish Government into how people with how people are treated with neurological conditions. So varying different neurological conditions. So we did some work on that as well, around about working with colleagues in the Scottish Government to think about ways that we could involve people with neurological conditions and going out and meeting people. And it was back in the days when we did go out and meet people. It was kind of the last thing we did before COVID, I suppose, in terms of meeting people face to face. So we did kind of go out and meet folk at the end of last year there, and that's the sort of thing that we would do. So these sorts of pieces of work. Sometimes it might be that we just signpost if there's already consultation work going on, or there's somebody else who's kind of taking the lead on it. So we might do some signposting, but sometimes we might be a bit more active in our role in supporting those sorts of engagement activities, and carrying out focus groups or discussion groups or visiting groups and gathering views that way. So it is sometimes the work that we do is very direct, and it is face-to-face contact in terms of national policy, and sometimes it's more a bit of signposting. If we're not got a specific request from the government, maybe to do that kind of on the ground bit, then it's more likely that we would be signposting people to the people that are doing that piece of work, which might be the folk involved, in the report writing themselves in some cases.
Okay.
So I hope that answers the question.
Thank you. Yeah, thanks.
Okay, I'll probably just carry on. We just thought that you might want to hear a little bit about sort of an example of type of groups that we engage with. And patient participation groups are quite a big part of our work. So for those who've never heard of patient participation groups, we call them PPGs for short. It is they're a patient group that are directly linked to a GP practice, with the purpose of helping the practice to engage with their patients and local community effectively. And it's a very much two-way communication between staff and patients. The groups generally meet every couple of months to discuss current issues that the practice may face and may offer solutions, help to find solutions. Some groups undertake activities such as, for example, collecting feedback from patients, whether it's through creating online surveys or speaking to individual patients to gather their thoughts on a particular subject. Many groups focus on health promotion and information sharing. Some organize events, galas, fairs to promote healthy lifestyle. And the kind of we've included some pictures then there for you to show on the previous slide.
Oh, nice.
It's the Keith Keith Patient Participation Group, one of the most active groups that we have here in Grampian. There's about 15 groups in Grampian and about 120, I think, over across the whole of Scotland. Right. But Keith has been particularly active, and just a couple of highlights from their work is when they had a petition calling on the Scottish Government to provide funds for a new health complex in Keith. And they gathered signatures at Keith Country Show. And their voices have actually been heard because they heard back from the Scottish Government, and it's very likely that they will be getting a new health centre. And in the meantime, they were also conducting research and surveys to find out what people thought in terms of the services that should be provided within the new health centre. So it's just an excellent example of engagement with their community, which supported both patients and the practice. So that's the Keith, some representative of the Keith PPG up in the top picture from the Keith Country Show. And then another activity that they had was supporting their practice flu clinic, and it's the bottom picture. So they used to do that every year, and they had hundreds of people through the door, and they provided tea, coffee. They had information stalls with just support services that patients could benefit from. So obviously it's not something that could be organized this year, but it just gives you a flavor of how this two-way communication between patients and the practice can work. And we would encourage you to check with your local practice if there is maybe already a PPG running that you can join. And if your local practice doesn't have one, then maybe you can make the suggestion to the practice manager, and they could think about setting one up. And you can get in touch with us or our colleagues, depending on where you're based, if you'd like to request support in this process. So we'll display our contact information at the end of the presentation if you wanted to get in touch. And maybe something else I could add on this is that we do try to organize networking events for patient participation groups, and we have done a couple of them in the past few years. And we had a big one this year, which was fully virtual event, and it was a little bit wider because it focused not just on PPGs but on the whole of primary care, so connecting patients and staff and third sector colleagues as well, to discuss sort of best practice of community engagement. So some of you may have heard of this event or maybe even joined, but if you haven't, we're in the process of uploading this information on our website. So if you wanted to find out what has been discussed and shared, then again, I think we have our website displayed at the very last slide of this presentation. So I think this is all from me. I'll pass on to Chris to tell you a little bit more about Voices Scotland and other things that you can get involved in.
Thanks, Gosia.
Hi there. Yep. So another piece of work that we have regularly run in the past is Voices Scotland work. And as you can see, Alistair, you mentioned the Learning Disability Group of Aberdeen and Aberdeenshire. There's them at one of our Voices Scotland sessions that we ran. That's probably a few years ago now. What the training covers is it covers quite a lot of stuff. It was originally developed by Chest, Heart, Stroke Scotland, and the idea of it is to build capacity for individuals to influence services. So it can really be any service. It doesn't specifically have to be NHS or health and social care. Although that's kind of where we're coming from. That's our job role is obviously specifically about that. But the skills can be used to influence any other service, really. Part of the training does cover learning about the structure of the NHS and the health and social care partnerships, which is obviously an ever-changing picture. So we just try and keep it kind of simple and basic as much as possible. Part of it, the kind of final sort of stage is around about making a case for change. That's, I think, one of the parts that's most useful for people. And in fact, the Learning Disability Group of Aberdeen and Aberdeenshire did complete a case for change following the session. They approached the health board with it, and the health board came back to them and spoke to them in a couple of their meetings and did actually change the way that they were delivering the particular service. So, it's quite a positive, the idea is to turn a problem into something actually that can be a positive change for both the health board and the individual's experience.
I'm just thinking about that, because that's one of the things that it's often one of the hardest parts, is to actually make any consultation meaningful and have an actual impact on the outcome. Because sometimes in the past, some other have tended towards information sharing rather, so decisions have already been made about layout or how things will operate. So getting things early enough so that you can actually impact the decisions as they're being made, rather than undoing them, is hugely significant, because that trust, you need that trust, do you? Because if people are going to engage with you time after time, they've got to see that not only will their voice be heard, but it's going to make a difference.
Absolutely, yeah. And I think the thing to remember is for any community service, any public service, we do have the right to influence that service. So although there's legislation that might be stricter in terms of the NHS and now coming in health and social care, there's and there may not be so much about some other public services that we access. All public services should still be engaging with their communities that they provide services for. And sometimes when they don't do that as well as they could, or if there's something that maybe they're not thinking about, everybody using the service has a right to raise a concern that they have, and that can often just be done through the feedback service or complaint service that the body has. However, another way to do it is kind of what we talk about in Voices Scotland, is kind of more of a group approach where you're working on a shared problem together, and looking at and analysing that problem. You're looking at why it occurs. Given the making a case for change is really good, because it kind of points out impacts that people feel it may have on them as an individual, but also on the staff members that have to deliver that service. So it's kind of taking the whole view at it and using legislation and that to back your kind of self up as well. And it's all about, ultimately, it's all about working in partnership to improve the health of the community. So in terms of health and social care services, it should be something that health and social care providers really are interested in looking into. And they can't really ignore communities that are coming to them with issues. They do have to address it. And it is there in legislation that they have to address these things. So the way that they choose to do that might be a little bit more flexible, but hopefully, things like in terms of like this example where the Learning Disability Group of Aberdeen and Aberdeenshire approached the board with a problem, they then opened up a dialogue and it was discussed and there was a solution, and it came to a solution between both parties. So hopefully that's what we would hope that work in this way would encourage. So it shouldn't always be an onus, obviously, on communities to approach boards with problems or whatever, but that said as well, there could easily be things happening that health and social care partnerships or boards haven't thought about looking at, and if you take it to them, then they should still do something about that. They should still act on it. So we can have the next. Yeah, absolutely. If we can have the next slide. So we talked a little bit earlier about kind of the gathering views stuff that we do generally for the Scottish Government, although sometimes within our own health board and sometimes with other partners. We have a kind of community engagement database, which is it's a national database, but we also we obviously have local contacts within that. So in Grampian, we tend to send information out to folk in Grampian, for example, and if you join up with that, that's generally where we'd be sending out information about when we're doing gather and views work. So we do, for gather and views, we do, I've kind of put it in the second part there, we do sort of look mostly at existing contacts, but then sometimes, things will come to us that we don't necessarily have a well-established local contact database around. So then we'll kind of look a bit wider, start to contact third sector partners in the area, and try and speak to as many people as we can. But anyway, what we do by kind of standard is that we do usually send out a monthly update, and occasionally we do send out additional updates during the month. So if you signed up to the database, it would maybe you can expect something every month, and maybe something every couple of weeks as well. So it's not necessarily just once a month. You have there's an opportunity to have your say. So a lot of the times we're sending out things about consultations that might be happening in Grampian, not just by ourselves, but by the Health and Social Care Partnerships and by the Health Board. There's an opportunity to take part in focus groups. So that would generally be our gathering views, complete questionnaires, but not just focus groups. I mean, we do events and workshops. Voices Scotland training, as I mentioned before, we do deliver that. I should have said in the previous bit about Voices Scotland training, we don't deliver that digitally at the moment, but we're very close to being able to do that. So we have worked out, we're working with colleagues in Chest, Heart, Stroke Scotland and ourselves, and we're working out how to kind of deliver some of that digitally. So we're hoping that early next year we'll be able to begin piloting that. So it is something, if people are interested in, get in touch and we can maybe look to arranging a session with you. We use for the gathering views, we try and use as much different methodologies as we can. So in the past we often get asked to specifically do focus groups, and when we're getting stuff from the Scottish Government, but a lot of the time we'll say, well, we might do this as well. Is that okay? And try something a little bit differently. And like go visiting groups where they are. We're quite keen on doing that. So we would tend to do that quite often. And obviously now we do have to consider the digital factors. We can still deliver a focus group online or whatever. And luckily, sometimes we can still go to a group if they do meet online, if they are managing to meet digitally. But we might be more just now tending to offer one-to-one discussions over the phone or things like that. So sometimes it's just about tailoring the method to suit the person's needs, and we're definitely up for kind of looking at that. So I guess the last slide that we've kind of got before kind of open up to you guys to see if you've just got any more final questions is just our contact information. So that's our website there for our part of the directorate. So I think you posted up there the one for Healthcare Improvement Scotland, and you can get to all parts of Healthcare Improvement Scotland if you go to the kind of main website. But most directorates have a website within the website type thing, and ours is that one there, https //www.hisengage.scot. And on that page you can find your local engagement officers' contact information. Lots of different tools to help you if you are carrying out engagement work, or if you're looking to engage with service users on specific topics. So maybe yourselves, if there was a particular piece of work that was relevant to you and you were thinking about how do I engage with service users, with my service users in this, well, look at our website. There's tools on there that could help you to do that. And lots of additional kind of support available there as well. And you can always contact us in the local offices. So our engagement offices, our contact details are on that website, and on the slide as well. I've provided our contact details. So that's our email addresses there, if you want to kind of contact us directly.
Perfect.
So I guess our last slide is just a kind of request for any further questions that you guys may have. Hopefully we've covered a lot there. Well, we have probably covered quite a lot. But if there's anything else, we're happy to take that.
So I was just going to ask, is it by health board area then? So the engagement officers, so you're obviously both working in Grampian. So it's not by local authority,
Yeah.
though, is it? It's just by health board then, yeah?
Yeah, so we cover 3 local authorities. You're right. Yeah. So we cover Grampian area, which covers 3 local authorities: Murray, Aberdeenshire, and Aberdeen City. So the structure when the organisation was originally set up, it was really only set up with health boards in mind. And that was because it was, the organisation's been going for, I want to say 14 years. It's probably more than that now. It's probably 15 or 16 years by now. So in that time, they were quite separate. Health and social care partnerships didn't exist, and health boards and local authorities were quite separate. Obviously, in terms of providing health and social care services, they now do that in partnerships. So quite a lot has changed since then. But yes, we've kind of kept that regional sort of structure, I suppose, if you want to kind of call it that, and starts.
Oh, we've lost Chris there. He's starting to break up there. So we've got a question here from SDS Options 5. It'd be good to hear about consultations in Fife. So I guess the advice would be to go onto the website and see what's happening in your local area, see what's available, and try and have those conversations. I would just say as well that my experience with Health Improvement Scotland, he's back. Let's see if we can hear it.
So sorry about that.
It's all right. This is the joy of the technical age. But I'm just saying that Health Improvement Scotland as a whole has been involved in quite a lot of interesting work in terms of trying to push things forward, being involved with doing some stuff with Des McCart over the years through In Control and otherwise, looking at creative and innovative problem-solving ways forward as well, which is always interesting to try and see how we can stop just keep doing what we're doing and try and think about, what the next step is.
Yeah. So in terms of that specific question now, which is about consultations in Fife, anyone in Fife could contact the engagement officers who are linked into Fife Health Board, then, couldn't they? And they could easily get their numbers.
That's correct. Yeah, yeah.
That's
the best
right.
thing to do would be to pop onto our website.
Yeah. I think we're talking over each other. There must be a delay. Our website has all contact information for all our engagement officers, and I believe our colleague in Fife, his name is Kevin Ward, and if you struggle to find the information, feel free to get in touch with us directly, and we'll give you his contact details.
Yeah, thanks. Yeah, so how do you both envisage things going forward? Because obviously we've been doing these webinars or these Wednesday live streams since sometime probably in April, I think. And these were a response to the pandemic, but we're also beginning now, at least, to have a little bit of opportunity to think the world might get back to something approaching normality sometime in the next year. So how are you viewing in Health Improvement Scotland the things going forward and the things that you've been doing? Because you're talking, for example, about doing the voices work online more or doing it more digitally next year. But we'll. So just really, any thoughts about things going forward?
Yeah, I think
in terms of our organization
stuff. Oh, you go, gosh, that's it. You go.
Go for it, Chris.
Okay, so in terms of the things like the Voices Scotland, they are probably, this is the issue with having two of us on at the same time, they are probably better done face to face. However, having said that, having the digital options will be really useful because sometimes we, like the last one we did, I think I was going to say just before it got cut off, was actually up in Murray, so it was quite a remote part of Murray. It took actually my colleague from Fife came up to help and help out for that session because Gosia was unavailable, and it took him the same length of time as me to drive there. So So it's quite it kind of tells you.
Oh, he's gone again.
Chris is away again, Gosia. Yeah, it's an interesting thing, though,
He's
isn't it?
gone again.
Yeah. It is an interesting thing because it's all this stuff about. I mean, we in our AGM yesterday were talking about building back better. This idea that when things do go back to some sort of normality, we don't want them to go back to the old normality. We want to go back to something that's better, both more useful, more effective, more efficient, all those sorts of things, really. So it's an interesting challenge for us as things do begin to open up again, hopefully over the next.
Absolutely. We have been presented with huge new opportunities to be linking with people that we wouldn't be able to link in normal circumstances. So I think we want to continue that and use that kind of flow that we have now, develop the digital tools, because you never know what the future will bring. And as much as we enjoy the face-to-face communication and it's you can't underestimate the value of just a face-to-face meeting, but with a national organization that we are, it's sometimes really difficult to connect with our colleagues or travel to a meeting that's on the other side of Scotland. So it's been very helpful to be able to be linking in digitally.
Mm-hmm.
And I think what we have been told so far was definitely are going to be still working from home until the end of March, and then I think this will be reviewed depending on the situation. So hopefully things will start to open up again, and we'll be able to travel at least a bit and meet people face to face, but still keep the digital element if we need to.
Mm-hmm. Yeah, it's about getting the right. It's about in the future. It'll be about getting the right balance, taking the opportunities and the different things that this has given us, and hopefully adding them to the things that we know work really well before, and also getting rid of some of the things that didn't work as well. Maybe.
Yeah.
Chris is back, and I don't know whether this is true, but maybe it's third time lucky.
Oh,
sorry. You must get so much of that, Chris. Sorry, apologies. Okay, so we have Alistair. We're probably at the end of our time for this week. So at the end of each of our webinar Wednesdays, what we do is we go around and just ask people for their final comments. So let's just do that. Any final thoughts, reflections, things that you'd want to share? Do you want to do that so we don't get into it? Gosia, do you want to do that first?
And a final, sorry, could you repeat that, please? And a final thoughts?
Any final comments, thoughts, reflections, that you want to make, either about how things are, things that you think about for the future, about your own work. Yeah.
I think, we're both Chris and I are very excited about the Voices Scotland sort of element of our work, and we always have been very passionate about delivering that training. And so as Chris mentioned, we're working on sort of developing a similar tool that we can use online, and I think it'll be really exciting if you guys and your group would want to maybe undertake that training. And so please do get in touch if it's something that interests you, and we'll be happy to run it. Maybe the first pilot with you. Who knows?
Sounds good.
Thank you. Chris?
Okay, I'm a little bit scared to talk now in case it cuts me off again. I don't know what I was saying that it didn't like before. I think, I mean, as Gosia said, we really do enjoy the voices, and that's really something that's quite a reward and part of our job, especially when we get to see the outcomes, like in the example I used today. But I guess for me as well, it's one of the kind of big things that as well we've led on in Grampian has always been the sort of the engagement around about primary care, and I would really like to see more of that. And I think digital methodologies have been coming out through primary care in terms of the way that they've been engaging with communities, particularly at GP practices. Some of them have started using things like Facebook and things like that to communicate a bit more. So embracing that social media. So for me, that's something I'd quite like to see, and I'd be really happy to support people with is groups and individuals and getting a bit more involved in how community engagement can happen and work better in terms of primary care, and how we can embrace digital methodologies to help support that, as well as still retaining the face-to-face.
Okay, thank you to you both. Alistair, have you got any final comments? I was just thinking the worst thing you could do, definitely the thing that would get you kicked off Facebook would be if you burst into a Michael Jackson song, because that's all. But anyway, I think we're okay. We're okay. Alistair, final comments?
So it's just thinking about that whole thing about that, where, as you were saying, Keith, about stopping doing some stuff that didn't work. And I think it's that we've talked a little bit today about access, for example, for organizations like yourself to things like social media, what's been allowed, what's been banned, and things like that. Use of apps. There was a lot of fear around about engaging in a lot of digital stuff. There's a lot of people with learning disabilities who themselves wouldn't have thought about engaging in online discussions and meetings. So it's pushed us to normalise a lot of this stuff. And I hope that does help us to reach different people, both from rural areas, and enable people for transport and things like that, and that we don't go back to tightening up the rules again afterwards, because I think it's definitely not a replacement, but it's good to have, as well as we've had people who've got more engaged, digitally than they were previously able to do physically. So I think just that. Yeah. Keith?
Yeah. Well, mine's just maybe a reflection from yesterday as well, again from our AGM, and it's about not letting systems get in the way again of people getting the right support and directing the support in the way that makes most sense and works for them. So mine's maybe just a little reflection on that. So I would say thanks to our guests and today, Gosia and Chris. I would say good luck on your travels, Alistair. You will be back next week in time for next week's webinar Wednesday.
Yes.
We have Feel Good Friday this week, and you won't be involved in that because you're not around, but I'll be involved in Feel Good Friday. So if anybody wants the link for that, get in touch. Next Tuesday, we have our next Tuesday talk at 2 p.m. with Dr. Danielle Farrell, and she'll be reflecting on how things have been going this year and how things have changed. And again, some of the things that we've talked about just now, some of the opportunities and challenges of that. That's it over this week, I think, isn't it, Alistair?
That's it. And then next week we've got Jay Moyer, who'll be joining us, who's the first qualified gym instructor who also has cerebral palsy. So
yeah. Interestingly, Alistair, I know a couple of weeks ago you shared the story of someone in the United States who'd completed an Ironman, a man with Down syndrome. And so you must have been very quick taking that up, because it was on the radio. It was on Radio 4 this morning, talking to him.
Yes.
And his dad.
Yes.
Yeah. There was a wee interview with him, so that was really interesting. Okay, so thank you to our guests, and we will be back next week.
Thanks again. See you later.
Thank you for having us.